So, safety culture is the beliefs, values, and norms that are shared by members of an organization that then influence their actions in pursuit of safety or to make sure they're providing safe care. So, actions and behaviors as well. The other really important piece that makes us connect safety culture with postpartum hemorrhage is that 28% of pregnant people could be identified before labor as having a risk for experiencing hemorrhage with just currently available tools. And actually, 70% of maternal deaths that are due to hemorrhage are preventable, which is one of the highest rates of preventability in all of those maternal morbidity mortalities. If you look at this paper specifically, having enough people to actually respond and activate that hemorrhage protocol is really important. The other thing that comes across is having people who are experienced and kind of able to stay calm in a stressful situation because they've experienced that before. So knowing what the first set of interventions are, usually those are going to be something like uterine massage, then there might be some medications that are administered, and then what happens from that point, who needs to decide what elevations are going to be. And the people need to be familiar with that protocol. So oftentimes you will see some training or some simulations to help get folks familiar. And I think one thing that I see a lot in healthcare teams is attention is this idea that having a stable team that work together regularly really is the best, because those people get familiar with each other and gain experience working together, and then they can better anticipate who's going to do what when, and that lets them coordinate a little bit better, or they develop their own shorthand communication or even nonverbal communication that they understand really effectively and really quickly, versus if it's a group that's never worked together, there has to be some more explicit communication and coordination behaviors that quite frankly just take time. And this is something where time matters a lot. However, that is a challenge in healthcare. So my group is working on technologies and strategies that can help support those teams that are not necessarily able to stay stable. And of course, things like closed loop communication. When someone asks for something and you start to do it, you say it back so that they can confirm you're doing the right thing. That comes up.